So the hospital I work at is the only one in the area that does water birth. Like not laboring the water, but you can labor and birth in the water. And I love a water birth. But I found this article, it's fairly new, March 2024, from the American Journal of Obstetrics and Gynecology. And it's a systematic review and meta-analysis, which means they took a whole bunch of studies and they put it together to kind of like synthesize all that data. And I want to talk about what they found. So they looked through over 20,000 articles, and 52 of those articles were included in this meta-analyses. Based on data from observational studies, water birth was not associated with an increased probability of maternal infection as compared with land birth. I love that they call it that. Patients undergoing water birth had decreased odds of postpartum hemorrhage. I'm going to skip this and come back to it because I want to talk about it. Decreased odds of low APGAR scores. That's basically a baby coming out needing help. Decreased odds of neonatal infection. Decreased odds of neonatal aspiration requiring resuscitation, and decreased odds of going to the neonatal intensive care unit. The only increased risk that they found was something called cord avulsion. Now, cord avulsion happens when the umbilical cord gets pulled too tightly and it snaps. And I feel like I know exactly how this happens because it's happened to me. Well, it happened to my patient, but I was there. So when you are birthing as a mermaid, okay, you're in the water, and when the baby comes out, oftentimes mom grabs baby and brings baby up, okay? There's a lot of excitement and joy and love and all that stuff, and as we're pulling, we can't see quite how long that cord is if we're under the water, and sometimes that can be a short cord, and we go to pull, and it can snap. The one that I was in, it like happened, it felt like slow motion, like no, because I saw it getting tight and I was like, stop. And whenever she heard me say stop, she like pulled the baby up like to see what I was looking at, and it goes psst. It's not a huge deal. You don't get the delayed cord clamping, which we want for babies. I guess it's kind of like doing in the old days where the baby would come out and be like clamp 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 immediately. But if you avulse the cord, you've got to clamp both ends so that you're not bleeding, So I can definitely see how a cord avulsion could happen more often as a mermaid birth than a buffalo birth. Just trying to think of a land animal. I don't think you're a buffalo. It's just the only thing I thought of in the moment.